Occipital bone, Lucent study notes. Occipital bone, a single unpaired bone forming the posterior and inferior part of the neurocranium. Protects the brain posteriorly and connects skull with vertebral column. 1. Parts of the occipital bone. Squamous part, posterior superior flat portion, forms the back of the skull. Basilar part, anteriorly projecting inferior portion, forms part of the skull base and supports brainstem. Lateral parts jugular processes paired, located on either side of the foramen magnum, contain important canals and articulations. 2. Sutures and variations. Lambdoidal suture. Articulation between occipital bone and parietal bones. Posterior skull suture. Wormian bones. Small extra bone pieces within the lambdoid suture. Accessory bones. Common non-metric trait. Lambda. Point where lambdoid and sagittal sutures intersect. Important craniometric landmark. Transverse suture. Occasional. Separates apex of squamous part from rest of occipital bone. Leads to formation of an Inca bone. Inca bone. Separate apical portion of occipital bone. Found with high frequency in Peruvian populations, may be single, bipartite or tripartite. 3. Foramen magnum and condyles. Foramen magnum, large opening at base of occipital bone, allows spinal cord to pass from brain to vertebral canal. Occipital condyles paired, kidney-shaped articular surfaces located anterolateral to foramen magnum. Articulate with atlas, first cervical vertebra. 4. External occipital surface landmarks. External occipital protuberance (EOP). Midline projection above foramen magnum. More prominent in males, reflects muscular robusticity. External occipital crest median nuchal line. Ridge extending downward from EOP. Attachment for nuchal ligament, supreme nuchal lines. Faint ridges extending laterally from EOP. Uppermost muscle attachment lines. Superior nuchal lines. Well-defined ridges projecting laterally. Major attachment for neck muscles. Nuchal torus. Thickened ridge between superior nuchal lines. Rare in modern humans, prominent in fossil hominids. Inferior nuchal lines. Located below superior nuchal lines. Additional muscle attachment sites. Sexual dimorphism note. Nuchal lines in EOP are usually more prominent in males due to stronger neck musculature. 5. Basilar part features. Pharyngeal tubercle. Small midline elevation on basilar part. Attachment for pharyngeal muscles. Pharyngeal fossa. Depression near pharyngeal tubercle. Non-metric trait. May vary among individuals. 6. Canals and foramina. Condylar canal. Small canal near occipital condyles. Transmits emissary vein. May be present, absent, or only a fossa. Hypoglossal canal. Canal passing through occipital bone near condyles. Transmits hypoglossal nerve, CN12. May be divided internally or externally. May be partially divided. Important anatomical variation. Subscribe Medical World.